Welcome to Academy of Ultrasound Sonography Update. This is John Sheldon based in Honolulu, Hawaii, and today is July the 22nd, Friday. Today's interesting case, patient came into the ER with severe shortness of breath, wet lungs, having a really hard time breathing, had a mitral valve replacement, a porcine mitral valve replacement done in November of 2010, so not quite 8 full months old, and had no previous problems with the valve to his knowledge. Upon looking at the probe, or putting the probe to the patient's chest and looking at the patient, we're getting a gradient across the mitral valve of 24 mean millimeters of mercury and 47 max. For those of you who aren't aware, a mitral valve is considered stenotic or is considered abnormal with anything of a mean over 10. So that's a severely increased gradient for a mitral valve. Unable to see the valve very, very clearly due to patient imaging windows, recommended TEE. Subsequent TEE was done, and the valve leaflets inside the porcine valve are thrombosed and almost closed shut. Very, very little growth, or very, very little excursion, and the thrombosed valve leaflets are sitting there growing on themselves. Putting the patient on anticoagulant therapy to try to see if that'll help. Of course, he's staying in the hospital, and in a couple of days we'll repeat the echo to see if it's doing anything, or they may have to go back in and actually replace this valve. It's unclear what would have caused thrombus to start developing on the valve leaflets. Typically, you're not put on blood thinners when you get a bioprosthetic as opposed to a mechanical valve. So keep in mind, when somebody's got a replacement valve, you definitely want to get really good gradients from multiple windows. He wasn't quite that high from the typical apical 4 view. It was from an apical 3 chamber view that we were able to get that really, really increased gradient. When they put a mitral valve replacement in, typically it's kind of off-centered. It's kind of tilted towards the aorta, and you won't get a real clean shot until you do some very movement of the probe and possibly even some unstandard views to try to line that Doppler signal up with that mitral valve to try to get the best gradient you can. And again, check in multiple places. So for today's sonography update, this is John Sheldon, and I look forward to talking to you tomorrow.